I wrote a little forward for my book, and maybe I should just read to you one sentence, right? And I said, it sounds radical, but for me it confirms what I've always sensed in medicine, that our biology is more than chemistry, that healing isn't about poison or power. It's about unlocking the potential already within us. After all, so much of modern cancer treatment has its roots in warfare. Chemotherapy derived from mustard gas, radiation from nuclear weapons. So we've inherited a medical paradigm shaped not for healing, but for short-term survival, scarred by fear, power, and control. Despite incredible advances in genomics and immunotherapy, those in power, meaning the pharmaceutical giants, government regulators, even elite medical institutions, continue to enforce a system that prioritizes money, prestige, and consensus over the lives of real people. Corruption and regulatory capture only deepen these systemic failures, and I go on. So, what I discovered and why I left and why I sold all my companies was a lifelong belief that you and I have this killer cell in our body called the natural killer cell. And that's really the name of it. It's called nature's killer cell. But it was only discovered in the 70s, and I wrote my first paper in the 90s. That killer cell we've never understood. We can now activate that killer cell and understand what receptor is on that cell, that if you inject something called IL-15, a protein that your body's making, that would stimulate that killer cell, you now have a chance to completely attack cancer of all types. So going to the FDA, they've approved a drug called Epogen, which is for anemia. The way they approved this in the 90s was if you have anemia, regardless of your tumor type, you get Epogen, and that makes sense. It's like getting a blood transfusion. You don't ask, you lost blood, is it from a gunshot, or is it from a cancer, or is it from chemo? You get blood transfusion. So then they approved another drug called Neupogen, that if you have a low neutrophils, which prevents you from having infection, they give you Neupogen, regardless of the tumor type. Well, if you have a low NK cell and T cell, which we've discovered, and we give you this IL-15 and stimulate your NK cells and T cells.
When NK meaning natural killer.
Natural killer. And when you call these two together, it's called lymphopenia. And to measure it, a $20 test, that when you do your CBC to measure anemia, there's a thing called ALC, absolute lymphocyte count. And if it's below 1,000, it's like having anemia. But more importantly, you don't have NK cells and T cells. Without NK cells and T cells, those are the only cells that fight cancer or fight infection. So you should inject yourself to actually get that up. Well, we got this approved for bladder cancer. It took us 10 years. We have now patients with bladder cancer alive, free of bladder cancer, 10 years out. I went to the FDA to say, okay, I want it now approved for the other type of bladder cancer for which we have 100 patients. They refused to file. They refused to look at the data. Now that is mystifying.
Mm-hmm.
Then we have the same thing for pancreas cancer, lung cancer, head and neck cancer. And the response is, instead of understanding that if you have a low ALC or low NK cell, natural killer cell, it's like having low hemoglobin for anemia, you give yourself a shot. They declined.
They won't even look at it?
They won't even look at it at that point. They call it a refuse to file. But more importantly, I now have to do every cancer type, which will take 3 lifetimes. Lung cancer, pancreatic cancer, triple negative breast.
What do you mean you have to do a test, like a
randomized trial?
Randomized trial.
Every cancer type. That doesn't make any sense.
Before you can get your drug approved, is that what you're fighting for?
It's already approved.
So what are you fighting for?
I'm writing for the FDA to understand that anybody with a low NK cell or low lymphocyte count, and these are the most important cells in your body. Yesterday, the Washington Post published the oldest living person alive on Earth, 117 years old, just passed away. The thing they discovered in her was an active NK T cell, the active immune system, which completely validates the most important thing to keep you alive, even to longevity, but to fight infection and cancer are the cells that kill cancer. It's as simple as that.
Is it just a shot? I mean,
It's just a shot. It's a subcutaneous shot. I gave it to myself.
I remember you saying that.
No, it's a separate shot I gave to myself. It's a whole platform.
Oh, explain.
Yeah, because we had the short time the last time. This was during COVID now. So in 2019, I recognized COVID was coming. I was petrified about COVID. I slammed. Because it's not a normal virus, this virus. It goes into every blood vessel in your body because it uses a receptor of your blood vessel. So it's not a respiratory virus. It's basically like cancer. And I wrote a paper. It's systemic, which means that once you get this virus, you have to clear it out of your body. It's no different from human papilloma virus, HPV, that a lot of people know about. It's no different from hepatitis. These are the viruses that cause cancer. So you have to get it out of your body. The only way to get it out of your body is through the T cell and natural killer cell. I sound like a broken record. So I developed a vaccine, you may want to call it BioStrike, BioShield, that actually stimulates your body to create T cells against the COVID virus and clears the virus. So when Operation Warp Speed came about, I spoke to Peter Marks and said, the right thing to do for our country is for every company to throw the vaccine into this trial where they were testing it on monkeys infected with COVID and see which vaccine clears the virus from your body. I don't care which one. I don't care if it's not mine. It should be the one that clears the virus. I was the only vaccine that cleared the virus.
So he did throw it in there.
I threw it in there. The others stopped throwing it in. Interesting.
Why? Is it about the almighty dollar?
It is about the almighty dollar because by that time, Glaxo, Pfizer, BioNTech, Moderna had created a vaccine for antibodies. But I said it didn't make any sense because it's whack-a-mole. The spike protein for which they're creating an antibody would keep on changing.
Which it did.
And even now, the vaccine that's been about to given is already obsolete because the virus has already changed again. You got to clear the virus. And unless you clear this virus, you then have a chance, sad chance of having the virus causing inflammation and inflammation causing cancer. That is why I believe younger people now, for the first time, and when I was on the first show with Tucker, I said my greatest fear of a pandemic of cancer happening on a global basis, and it takes 5 to 10 years of latency for this inflammation to occur for viruses to cause cancer. So I did the phase 1 trial, got it through, and I injected myself and measured T cells against the vaccine. And then Pfizer and Moderna and everything got approved and sucked up all the resources of the materials, and they vaccinated everybody, which is the right thing. So during the Trump administration, giving that vaccine to actually reduce mortality was the right thing. However, you needed then to follow on with a booster to clear the virus because that vaccine did not prevent.
You don't mean the booster that they were giving. You're talking about your kind of booster. Yeah.
So I applied to the FDA. Now we're in Biden administration. So I forget the year, but I applied then to the FDA for the phase 2, where I would be the booster to the. They refused. Not only refused, they said they could not to this day explain why they did not allow me.
Is there a downside to this injection, this stimulator of the natural killer cell? Like, is there a risk that they were afraid of?
No. They said, we don't understand T cells.
I mean, we didn't understand COVID or mRNA not long ago either.
We didn't understand T cells because... So then I did a podcast with the science editor and Peter Marks.
Who's he?
I forget his name, but I'll send you that podcast is live on YouTube.
Okay.
The science go, I'm sorry, I forget his name.
That's okay.
He's going to get mad at me, but he's a good guy. He said, let's do a podcast, a live podcast and video podcast, and have Peter on and you on and ask this question. And you should listen to this podcast. And to this day, they said, no, don't worry, we'll give you guidance. And they've never did that. So I went to South Africa and did the phase 2. But then we ran out of materials, and now it's not possible. Then I focused on what you call now the BioShield. So the shot I gave myself then was the vaccine to provide long-lasting memory T cells. From the very first COVID, which was called MERS, way back 17 years ago, those people got T cells to the COVID to not get COVID.
Wow.
So this is the whole point. You get long-term memory, not only so that you don't have this inflammation, so that you don't transmit to another person.
A true vaccine.
A true vaccine. So now you understand my...
You don't have to tell me who, but did you give it to anybody else?
Well, we did phase 1.
So yes.
And
how did those results come out?
Well, they all had T cells.
Same thing.
Even in South Africa,
they didn't get COVID.
Even in South Africa, the patients with HIV we gave them generated T cells.
Okay, so they generated the T cells, but then did they do the thing that they're supposed to do? Did the people not get COVID?
Well, of the phase 1, we only did very few patients, to my knowledge. Not only they didn't get COVID, but I've got some, now these are anecdotes, so, I'm a scientist, you need to do big trials, and so whatever I'm telling you now is really just anecdotes. But of the people that I knew personally, because obviously, said my spouse got COVID, she got the vaccine, and I was with her, sleeping in the same bed, I didn't get COVID.
The Pfizer or Moderna vaccine?
Correct.
Okay, not your vaccine.
So it's protective. So that was one level of frustration, and I said, okay, fine, it's time to move on, because we didn't have the resources now at this point, nor the material to this BioShield of actually stimulating the natural killer cell. Because
can you just, for us non-scientists, what does that mean? Like, what kind of resources or materials would you need? Do you have to have government buy-in to realistically do a study like that?
Because you need to grow these cells in order to make this.
So you need permission.
Not permission. You need the material. All the materials being sucked up. Remember, there was during this period of time that the allocation of the plastic bags, the media, the culture, the systems were being allocated to Pfizer and to Moderna. And it's like electricity or gas is not left.
Okay.
Right? To this day, in the entire history of everything I've developed, not one penny has come to me from the government. Not one.
And that's unusual.
We funded it. I funded it myself personally.
We talked about this last time, but you were paid between $9 and $10 billion for your drug companies that you developed on your own as a working physician and researcher. And so you are able to self-fund this, but you're saying it would be easier with the government's help, and you actually can't get access to the materials you need to do what you can do without the government's help.
And that was during the Biden administration. Now you understand when Biden and Kamala and the people and the HHS secretary during that time, and why was I why we were put on hold? Why was this not allowed? I can't get that answer. Never did get that answer. We'll never get that answer.
So now we've had Trump for 8 months, and
now I'm into the BioShield. So now we've gone from COVID. Now I worry about long COVID. Now I worry about what is this virus doing in our body now. Now we get into this idea, is it the vaccine or is it the virus? I don't know, because both of them have spike protein. It's a spike protein that I worry about, because the spike protein goes into the blood vessels and goes to every tissue.
Talking about now the super surge in cancers among young people,
Correct.
Colon cancer in particular, but many others.
I've never seen in the history, and I've been in cancer business, sadly, but happily, because I think it's a wonderful purpose of life, a 10-year-old, 12-year-old, 13-year-old cancers of colon. A colon cancer, so David Kern, I'll name him, he's the head of Oxford University, was almost in tears just 2 weeks ago. In his hands, a 13-year-old boy died of metastatic colon cancer.
That's crazy.
In my hands, in my clinic in Los Angeles, a kid from Butler, the same place, the same town where President Trump got shot, came to see me because nobody would treat this poor kid with metastatic pancreatic cancer.
Oh, no.
And so we tried to get the hospitals around to please treat the child, and we would help advise and send whatever we could. And they said, no, they can't treat this child because he's got an adult disease and they don't know how to treat pancreatic cancer. And I said, okay, fine, fly out to our clinic. And the poor kid with their family would fly all the way from Butler to LA. And we would treat him as best as we could. But the time he got to us, the child was so ridden with cancer, he passed away. Mm. And so there you ask from hope to despair. We do know now that if we catch the cancer early enough, even if you failed chemo, you failed radiation, brain tumors, we now have patients with brain tumors who have failed everything, come to see us. We're getting almost a complete response. We have a patient with head and neck cancer.
The tumors shrink?
Yes.
Just thanks to this injection, which will fire up your natural killer cells.
Correct. An injection together with NK cells that we infuse into the patient. That's it.
Wait, together with. So what's in the injection?
Okay, so let's talk about that because I think that's really important for your audience to understand. It's a platform. It's not a one shot. You come in, you go to CVS and you go home. What's in this injection is your body and my body is creating a protein called IL-15, interleukin-15. It's a medical term. That IL-15 is the trigger that your natural killer cells are looking for to stimulate itself.
It's like food for the natural killer cell.
But it only lasts for 2 minutes in your body when you get an infection because it wants to turn on and then stop. But giving something for 2 minutes, the NIH tried to develop this for 10 years. The NIH and NCI designated this IL-15 as the most important molecule to cure cancer. And they failed to develop it because they couldn't make it last long. More could they figure out how to actually just target directly the NK cells. We did that.
It's not a question of just having like an hour-long infusion.
It's a subcutaneous injection for 5 minutes. You inject it. It goes into your body. It stays there for 7 days. Oh. And during that 7 days, it proliferates your NK cells. So I'll just tell the public, I did it to myself. And
as a healthy man, you weren't dealing with anything.
In fact, we've done this with healthy volunteers already.
Okay.
More importantly, the NCI then designated us to
National Cancer Institute.
Yeah, to treat patients without cancer, i.e. patients with what we call Lynch syndrome.
Lynch.
Yep, which affects 1 in 280 Americans with an 80% higher risk of colon cancer, breast cancer, ovarian cancer, endometrial cancer. And we're giving them this BioShield together with a T-cell educator against those cancers. We've completed the accrual of that trial. So this is...
When did you begin doing this?
2 years ago.
And so those patients aren't showing they're not growing a third ear, like in terms of the downsides.
We've injected this in 8,000 patients already.
And what kind of response rate have you seen from the people who do have a cancer?
Metastatic pancreatic cancer. Patients now alive, still 6 years. Merkel cell carcinoma. Patients went for 9 years. Bladder cancer, which I just tell you, for which it's approved. Patients are free of disease 10 years.
Why?
Triple negative breast cancer,
That's just
complete
a tough
response after third line.
Why,
head and neck cancer.
Why bladder cancer? Why would it get approved for bladder cancer and be accepted as effective?
Because it was the first trial that was ready to go to the FDA.
But this is back to they want you to do one of those for each and every single kind of cancer. Okay.
And it took 10 years to get the bladder cancer thing approved. 700,000 pages of filing with the FDA. The review process took 2.5 years. It just got approved in April 2024.
Buy gold and get free silver. That's right. For every $5,000 purchased from Birch Gold Group this month in advance of Veterans Day, they will send you a free patriotic silver round that commemorates the Gadsden and American flags. It's like the Cornelius purchase of gold. Silver and gold all together, thanks to Birch Gold. Look, gold is up over 40% since the beginning of this year, and Birch Gold can help you own it by converting an existing IRA or 401k into a tax-sheltered IRA in physical gold. Plus, they will send you free silver honoring our veterans on qualifying purchases. And if you are current or former military, Birch Gold has a special offer just for you. They're waiving custodial fees for the first year on investments of any amount. With an A-plus rating from the Better Business Bureau and thousands, tens of thousands of happy customers, consider diversifying your savings into gold. Text MK to the number 989898 for a free info kit and to claim your eligibility for free silver with qualifying purchases. Before the end of the month. Do it before the end of the month. Again, text MK to 989898. Message and data rates may apply. Thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.